So we talked about how the scapular motions of upward and downward rotation are involved in elevation of the upper extremity, flexion, extension, ab and adduction. Now, what else do we need for elevation of the upper extremity? We need the rotator cuff muscles to stabilize that motion. So if your rotator cuff muscles aren't doing their job, it's pretty hard to elevate your upper extremity. So let's look at the learning objectives. Of course, we want to know the origins and insertions and actions and innervations. We want to be able to identify the 4 rotator cuff muscles and describe their primary function, which is stabilization of the head of the humerus in the glenoid fossa. So it's our dynamic muscular stabilization. We talked about shoulder stability in another lecture, and we talked about the passive stabilizing structures, the ligaments. Well, the rotator cuff muscles are the active stabilizing structures of the shoulder. They're not the only ones, but they're big players. So the rotator cuff consists of the supraspinatus, infraspinatus, teres minor, and subscapularis, sometimes referred to as the sits muscles, S-I-T-S, and that's your mnemonic for remembering them. They surround the humeral head anteriorly, superiorly, and posteriorly to stabilize the humeral head on the glenoid fossa. So they actively contract to pull the head of the humerus into the glenoid fossa as we elevate our arm and as we lower our arm. They function as dynamic stabilizers. So the ligaments are passive stabilizers. The rotator cuff muscles are dynamic stabilizers of the glenohumeral joint. So really important. We've got this joint that we expect a ton of motion out of. We need a ton of stabilization to support that motion. So the supraspinatus we talked about, it's one of the major abductors of the shoulder. It lies under the coracoacromial arch. It's deep to the trapezius and the deltoid. Can you palpate it? Yes, you can. It's right there in the supraspinous fossa of the scapula. You can dig your fingers through the upper trapezius and get right there on the supraspinatus. It inserts on the greater tubercle of the humerus. It has a common insertion called the rotator cuff with the other 3 muscles. It's shoulder abduction and stabilization of the glenohumeral joint. Those are its main jobs, and it gets the suprascapular nerve. The infraspinatus, it's mostly superficial. It lies below the scapular spine, and yes, you can palpate it. Its origin is the infraspinous fossa of the scapula, sometimes also called the infraspinatus fossa of the scapula. Both are correct and acceptable on an osteology quiz. It's inserts on the greater tubercle of the humerus in the rotator cuff attachment, which you can also palpate. It does lateral rotation as well as performing that lateral rotation of the humerus on the glenoid fossa, as well as performing the dynamic stabilization. And it gets the suprascapular nerve just like the supraspinatus. Teres minor is the infraspinatus's little helper. We've got little helpers. It's closely related to the infraspinatus in location and function. It's along the posterior lateral border of the scapula near the inferior angle. That's its origin. Its insertion is shared with the supraspinatus and the infraspinatus at the greater tubercle of the humerus. It does lateral rotation and dynamic stabilization of the head of the humerus and the glenoid fossa. And it's closer to the armpit, so it gets the axillary nerve. So if you remember that it's closer to the armpit, that can help you remember the axillary nerve. The subscapularis is on the anterior surface of the scapula, the subscapular fossa of the scapula. It does medial rotation, and it works in the rotator cuff group for dynamic stabilization. It gets the upper subscapular nerve. So subscapularis and the subscapular fossa gets the subscapular nerve. That should be easy, I hope. Or there's just so many of them, but yeah, there you go. So it also does medial rotation. It's the anterior part of the rotator cuff. So we've got supraspinatus, the medial part, infraspinatus and teres minor on the posterior, and subscapularis on the anterior, to just wrap around the head of that humerus and just actively hold it to the glenoid fossa. So the rotator cuff really surrounds the head. It actively holds the humeral head against the glenoid fossa. Supraspinatus, infraspinatus, subscapularis, and teres minor, all pulling that head of the humerus, kind of just sucking it into the joint, actively with muscle. Pretty cool, right?